Greyhound Urinary Tract Infection. Symptoms. ByeBye UTI 7-Day Bootcamp Day 1. Gail here on Day 1 of a 7-day bootcamp to make your Greyhound UTI free. I'm going to help you figure out if your Greyhound or other dog has a UTI and what to do next. So stick around. If you're new to the Greyhound Homecare channel, subscribe now and tap the bell so I can get the latest Greyhound news to you first, like this one-of-a-kind UTI prevention bootcamp. It can be pretty annoying when your Greyhound has a huge drink, cries to go out, can't make up his mind to go while he's out there, and then comes back in without doing anything, and then he repeats the whole cycle. But this is often a symptom. It's disturbing to find piddle puddles on your floor, but this is often a symptom. And it's shocking to see blood in your dog's pee. But this is often a symptom, and even just one of these symptoms can mean your Greyhound has a UTI, which means it's time to call the vet. If it's the middle of the night, make that call first thing in the morning and get your pup seen that day. The sooner the better. Why? Because he's miserable and so are you. The cleanup's awful. Unlike fine wine, this is not going to get better with age, and from here it can grow into a larger, more dangerous, harder to treat infection. Let's take a look at what's happening to your dog. He's gotten some harmful bacteria into his urinary system. Usually this bacteria is the E. coli type, the kind that comes from your dog's number 2. He tries to clean himself up back there, and sometimes things can get a little sloppy. Anyway, the bacteria is irritating the tube where his pee needs to pass through, which is a surprisingly small opening to begin with. And now it's getting inflamed and swelling up and making it even harder for him to pee and flush out that bacteria. That's why you may see your dog's pee coming out in little squirts or droplets instead of that usual robust stream. With no place to go, your Greyhound's urinary tract becomes like a petri dish, breeding and growing even more irritating bacteria. The cycle continues, and as you can now see, is on a downward spiral from here. The infection can go through his whole urinary tract, the tubes, the bladder, and his kidneys. So do this when your dog starts showing any of the symptoms. First, please be kind. I know you feel upset, you feel horrible. There may be a knee-jerk reaction that he's being a bad dog, but if you show any kind of irritation or disapproval, you're just going to make it worse. You're going to break your dog's trust in you, and then he's just going to go sneak off into a corner and do his little piddles there. And you'll be trying to resolve what you think is a behavior problem while your dog is getting progressively sicker. Now, your vet is going to want a pee sample, so stick around to see the easy way to do that. And then follow through with a full course of antibiotics that the vet's going to give you. The easiest way to get that pee sample is to find a container with a tight-fitting lid, tape the container onto a stick, and then move it under your dog at the critical moment. Snap that lid on the container right away, or things can get messy. When you get home, if you want, you can use a pH strip to help confirm your suspicions. I know this sounds very medical, but these are really very cheap and very easy to get from any drugstore. And once you buy them, you get like 100 at a time. You have them for forever. The UTI bacteria tries to neutralize disease-fighting acid in your dog's pee, creating a high reading. That would be over 7. The basic rule about using pH strips with dogs is anything between 6 and 7 is good. Usually about 6.2, 6.5, somewhere in there is normal. Anything below 6, that's a warning sign. Anything above 7, also a warning sign. Lily's sample is looking good. So folks, remember these signs: trouble peeing, peeing indoors, or blood in the pee. In Day 2 of the ByeBye UTI 7-Day Bootcamp, let's continue our quest to make your Greyhound UTI free for life. I'll bet your hound doesn't drink enough, so let's see what we can do about that. If Part 2 of this series has already been posted, you'll see it right here, so click on it right now before it disappears. So thanks a lot for watching, and I'll see you on the other side over at Part 2 on the Greyhound Homecare channel.